Hi, my name is Lacey Schooley, and today I will be demonstrating a clean catch sample for a urine analysis, the insertion, irrigation, and removal of an indwelling catheter. So the first thing I'm going to do is look over my healthcare provider's orders. So it's for Dr. Leo for his patient Lee Cost, 5/14/1964. So he's ordered a clean catch urine analysis and then the insertion of the indwelling catheter after the urinalysis, and then we will irrigate the catheter as needed and then discontinue the catheter later on today after surgery. Okay, so I'm going to enter the patient's room, perform hand hygiene. Hi Lee, my name is Lacey. I'm going to be your student nurse today. Can I just have you go ahead and verify your name and date of birth for me? Okay, Lee Cost, 5/14/1964. And Lee, do you have any allergies? Just the codeine? Okay, that's what I have on your allergy band. You don't have any allergies to latex or betadine? No? Okay, perfect. So Dr. Leo has ordered a urine analysis and also the insertion of an indwelling catheter. Have you had a catheter before? You have? Okay, perfect. So you kind of know how it goes. So I've instructed the patient for the urine analysis to clean the tip of his penis with 3 antiseptic wipes. 3 different times in circular motions from bottom to top, and let that dry, and then start voiding in the urinal, and then void in the cup, and then if he has to go any more, void the rest in the urinal. He has good sphincter control, so he's able to do that. So he's called me back, he's provided the sample, so I'm going to put on gloves. And then I'm going to get my label ready for the cup. So this label is pre-made for Lee Cost, 5/14/1964, and that's the patient I have. So I'm just gonna date and time it, and also put my initials. And then before I touch the cup, I'm just gonna get my biohazard bag ready to send the sample down to the lab in. Okay. So I'm gonna put the label on the cup, making sure it's in the correct spot, so that way if they take out the lid, they still know whose it is. I'm going to put that in the bag and remove my gloves, just in case my gloves are contaminated at any time. And get the bag together. And then a CNA has offered to run this down to the lab for me. That way it gets there within the hour, so I can put the catheter in. If it wasn't able to get there within the hour, I could put it on ice and bring it down later. So that's down to the lab. I'm just gonna clean my workspace. Okay, so I'm gonna perform hand hygiene. Put on gloves. And then get ready to put that catheter in. Okay, Lee, so I know you've said you've had a catheter before, so you know how this goes, so we're just gonna get everything set up, okay? So the first thing I'm gonna do is expose the patient. So normally the patient would have a bath blanket on to keep them warm and comfortable during the procedure. For this, so that way you can see what we're doing. The patient's going to be fully exposed the whole time. So I have warm water here, test it on my wrist to make sure it's not too hot. And I'm going to provide perineal care for Lee. Okay. Perfect. And then make sure he's all dry. Okay. And I'm done with this. I will change gloves since I was in the perineal area and get ready to open my catheter. So the package has not been tampered with. It's new, it's not expired. It's a 14 French. Normally for our male we'd use a 16 French, but for the video we're using a 14. And then we're going to instill 10 milliliters of water into the balloon after the insertion. So I'm just going to go ahead and open this package. Take this out. I'm going to put this in between Leo's legs and use this as a trash during the procedure. So this is the top. So I'm just going to only making sure to touch the outer 1 inch. Fold back and make sure to pull enough where they don't fold into themselves. Okay, and then I'm going to straighten out the workspace, pull out the gloves. Okay, so this first sheet I'm going to use as a non-sterile pad for this procedure, putting the shiny side down just to catch anything. Okay, at this point I'm going to remove these gloves and put on my sterile gloves, so not turning my back to my field. Going to unfold, cup end towards me, unfold the top, folding back, make sure that doesn't again fold into itself. Okay, and then grabbing the flaps. Okay, so I'm going to do my dominant hand first, grabbing inside the cuff, insert my dominant hand. Okay, and without touching the outside, I can pull the cuff down, and then I'm going to, with my dominant hand, put my hand inside and insert my non-dominant hand into the glove. Okay, and I can adjust the palms and the fingers, but I don't want to touch the cuffs. So now I'm going to get my workspace ready. I can touch all this because I'm sterile. So I'm going to take this off. I'm going to use this drape to drape the patient. Okay. Okay, so the lubricant that is in the packages, normally you would take it out and you would squirt it in the designated area. That way you can roll the catheter in. For this video, for the mannequin, we don't actually use this lubricant. We've already applied the proper lubricant for the mannequin. So I'm going to open my, I use these ones because I open on the wrong side on that one. Cotton swabs that already have the betadine on them, and then I don't need this, so then I'm going to take off this protective cover on the catheter, making sure that nothing comes out and touches an area that isn't sterile. Okay, let's put that aside. Okay, and then the syringe with the 10 milliliters of water, going to attach that to this green port. So that is all ready to go. And now I'm going to grab with my non-dominant hand the shaft of Lee's penis, making sure to have a firm grip and to not remove my hand at any time. And with my swabs, clean in a circular motion 3 different times with 3 different swabs. Okay, so now that it's clean, I'm going to go ahead and bring this box to the sterile field. I'm going to begin inserting the catheter. Okay, Lee, we're going to start inserting the catheter, so I just need you to take deep breaths, okay? And insert it. So the catheter would be lubricated 7 to 9 inches. I've seen urine, so I'm going to go an additional 1 to 2 inches. With my non-dominant hand, when it's in place, I'm going to grab the catheter, make sure it doesn't move, and then slowly begin instilling the water to inflate the balloon. Okay, so the catheter is not going to move. So I'm going to take this and hang the bag down. That way gravity goes down. On this stretcher, there's not really an ideal place to hang it. Normally, a normal bed would have a designated area to hang the bag, so I'm just going to hang it right here, but in real life, you would never hang it on the bed rail. Okay, so now I'm just going to clean up my area. So all of this can go in the trash. I'm going to usually we would use a special lock for catheters. For the video, we're just using tape. So I'm going to tape that down. And then also, since my patient is fairly mobile, I'm going to clip this to his gown. If the tube was excessively long, we could roll it up and wrap it on the bed next to him. Cover the patient back up. Okay, if there was any output, we would document the amount, the clarity, color. We'll document the time of the procedure, how the patient took it, and then how much water we instilled into the catheter. So now we're going to go ahead and clean this area up. Okay, so then we'll perform hand hygiene. Okay, so then at this point we're going to irrigate the catheter. So we'll enter the patient's room, close the door, close the curtain, perform hand hygiene, put on gloves. Hi Lee, it's Lacey again. Can I just have you verify your name and date of birth for me? So Lee Cost, 5/14/1964. Lee Cost, 5/14/1964. Perfect. Okay, Lee, so it looks like that catheter isn't draining properly like we'd like it to, so we're just going to go ahead and irrigate it, which will hopefully get whatever is blocking the drainage out, okay? Okay, so just going to gather all my materials to irrigate. So I'm just going to expose what's needed on the patient and put a blue chuck under the port. That way if there's any leakage, it doesn't get on the patient's bed, or the patient for that matter. Okay, so it looks like Dr. Leah has ordered the catheter to be irrigated with 30 milliliters of 0.9% normal saline. So here I have the 0.9% normal saline. So I have my new syringe, the needle, the clamps, and the alcohol swabs. So the irrigation kit has never been opened, never been used, it's not expired. So go ahead and open it with this container. Okay, so covering the label to protect it in case we spill any, we're going to go ahead and pour the 30 milliliters into this container. Then with a new syringe, before I do that, I'm actually going to clean the port, giving it time to dry. So we're going to clean this blue port where we're going to instill the irrigation solution. That way when I'm preparing the solution, it has time to dry before I go ahead and do that. So with the new syringe that's never been opened, I'm going to draw up the 30 milliliters. Okay, so I have my 30 milliliters. I'm going to attach a new needle. Okay, so that port is dry, so I'm going to go ahead and clamp the cord, that way the irrigant doesn't come right back out. Okay. Okay, Lee, we're just gonna go ahead and insert this in. Insert the 30 milliliters. So I see it going down into the catheter and then it's coming back out, so that's good. I'm gonna go ahead and remove that. And with the scoop method, scoop the needle back up just because it is clean, so we can scoop it. And if this doesn't get everything flowing again, we can re-irrigate it with the same needle. There's no certain time to leave the irrigant in, so we can go ahead and unclamp it right away. It's starting to flow like it normally should. So at this point, I would document the time of the procedure, how the patient tolerated it, anything that came out with it, the amount, color, clarity, all that. And then when we do mark on our output, we'll subtract the 30 milliliters since that's what we instilled and the patient didn't actually void that. So we'll go ahead and move the chuck. Normally we would discard this, but we're gonna use it again. So just gonna set it to the side. Then I'm gonna clean up my area. Since we don't need this needle anymore, I'm gonna go ahead and throw it in the sharps container. Okay, I'm gonna use that syringe again. This stuff, again, would normally be discarded, but for the video, okay, so then I would remove my gloves, document everything, and now it is time to discontinue that indwelling catheter. So enter the patient's room, close the door, close the curtain, perform hand hygiene. Hi Lee, it's Lacey again. I'm going to be your nurse, so we're going to take out that indwelling catheter, okay? Can I just have you verify your name and date of birth for me one last time? Okay, Lee Cost, 5/14/1964. Lee Cost, 5/14/1964. Perfectly. Okay, so Dr. Leo has ordered that catheter to be removed. So that's what we're gonna do. Okay. So to go ahead and start, again, we'd have a bath blanket under the patient for warmth, privacy, and comfort. For the video, we have the patient fully exposed. That way everyone can see what's going on. So, Kaylee, I'm just gonna put this chuck under you just in case there's any leakage, okay? Then we will get a clean syringe, never been used, to deflate that balloon. Before we do that, we have to clean the port. 10 to 15 seconds. Let that dry before we attach the syringe. Okay, so then to get ready, we're gonna unhook all these safety measures. Okay, then we're gonna attach the syringe. It will start drying up by itself. So before removing it, we check the documentation. We know that 10 milliliters was instilled into the balloon. Therefore, we have to get 10 milliliters out. So I drew up a little extra just to make sure that I did get all the fluid. That way there's no pain or discomfort with the patient. We can just discard this. And then I'm gonna go, okay, Lee, on the count of 3, I just need you to take a deep breath and we're gonna take this out, okay? Okay, 1, 2, 3, pull that out. Okay, then we will detach this. We'll go into the bathroom, we'll drain this, document the amount, the color, the consistency. We also will document that the tip is still intact in the catheter. Also discard this in the biohazard container. Remove our gloves. Perform hand hygiene. Okay. Put on gloves to. So in addition to all of that, we would document the time of the procedure, how the patient tolerated it, all of that. Okay. Okay, Lee, we're just gonna get you all situated. So, cover him up. Lee, did you need anything else? No? Okay. Okay, Lee, so in your bathroom, there's gonna be a hat in your toilet. That's so we can watch the output of your urine just to make sure that you're going the proper amount within a proper time. Because we want you to go to the bathroom within 6 to 8 hours, okay? Okay, so we're just gonna lower his bed to a safe level. The patient doesn't need anything else. He has his call light. So we've documented everything, left the room in a safe manner. We'll take off our gloves, perform hand hygiene, and that is it.